Hello and welcome. Today we're delving into a rare, but potentially life-threatening heart condition called Brugada syndrome. It's a genetic disorder affecting the heart's electrical system, and understanding it is crucial for both those at risk and the medical community. Brugada syndrome is primarily caused by genetic mutations. The most common culprits are mutations in the SCN5A gene, responsible for producing sodium channels in heart cells. These channels play a vital role in regulating the flow of sodium ions, which are essential for the heart's electrical activity. However, other genes can also be involved. It's important to understand that carrying a mutated gene doesn't guarantee you'll develop the syndrome. Other factors can influence its manifestation. The pathophysiology of Brugada syndrome centers around the disrupted flow of sodium ions into heart cells. This disruption primarily affects the right ventricle, the heart's lower right chamber. The abnormal sodium currents lead to uneven and prolonged repolarization, meaning the cells take longer to return to their resting state after an electrical impulse. This uneven repolarization creates a characteristic ECG pattern and predisposes the heart to potentially fatal arrhythmias, particularly ventricular fibrillation. Brugada syndrome is considered a rare condition. While precise global prevalence is difficult to determine, estimates suggest it affects roughly 1 in 2,000 individuals. It's more prevalent in individuals of Southeast Asian descent, particularly in Thailand, Laos, and the Philippines. Men are also significantly more likely to be diagnosed with Brugada syndrome than women, by about a ratio of 8:1. The age of diagnosis varies but often occurs in adulthood, although it can be detected in childhood. Many individuals with Brugada syndrome have no noticeable symptoms. This is what makes it so insidious. However, when symptoms do arise, they can be quite alarming. These include fainting or syncope, often triggered by fever, heavy meals, or certain medications. Individuals may also experience palpitations, dizziness, and seizures. The most serious symptom is sudden cardiac arrest, which can lead to death if not treated immediately. Diagnosing Brugada syndrome involves a combination of methods. The cornerstone is the electrocardiogram or ECG, which records the heart's electrical activity. The hallmark of Brugada syndrome is a specific ECG pattern in the right precordial leads V1, V2, and sometimes V3. However, this pattern isn't always present, requiring a drug challenge. This involves administering a sodium channel blocker medication like amylane or precanamide to unmask the characteristic ECG pattern. Genetic testing can also confirm the diagnosis, identifying mutations in the associated genes. While there aren't distinct types of Brugada syndrome, the risk of experiencing dangerous arrhythmias can be stratified based on several factors. These factors include a personal or family history of sudden cardiac death, spontaneous Brugada ECG patterns, or the presence of symptoms like syncope. Risk stratification helps guide treatment decisions and identify individuals who might benefit most from specific interventions. The primary treatment for Brugada syndrome is an implantable cardioverter, defibrillator, or ICD. This device continuously monitors the heart rhythm and delivers an electrical shock to restore a normal rhythm if a life-threatening arrhythmia occurs. Medication is not typically used to treat Brugada syndrome directly. It's also essential for individuals with Brugada syndrome to avoid medications known to trigger arrhythmias, treat fevers promptly, and maintain electrolyte balance. Lifestyle modifications, such as avoiding excessive alcohol consumption, can also be beneficial. Currently, there isn't a direct way to prevent Brugada syndrome since it's primarily a genetic condition. However, early diagnosis and management are crucial. Genetic screening can identify family members at risk, allowing for proactive monitoring and lifestyle adjustments. Avoiding trigger medications and treating fevers promptly can help reduce the risk of arrhythmias. Most importantly, understanding the condition and adhering to recommended treatment strategies can significantly improve outcomes. The prognosis for individuals with Brugada syndrome varies. Those with an ICD have a good chance of survival if they experience a life-threatening arrhythmia. However, the risk of ICD complications, such as inappropriate shocks, exists. Research continues to focus on refining risk stratification and developing new therapies. One area of interest is the development of gene therapies to correct the underlying genetic mutations. Scientists are also exploring alternative pacing strategies to stabilize the heart rhythm and reduce the need for ICDs. Ultimately, ongoing research offers hope for improved management and potentially even a cure for Brugada syndrome in the future.